Pediatric gynecology actually blends two of the things that I really love: the passion of speaking to patients, of attaching myself with families, of really building that relationship, spending time going through the developmental stage with the patient, as well as helping them through a particularly problematic time. My name is Jilynthia Trotman, and I'm a pediatric and adolescent gynecologist in the Mount Sinai Health System. The focus of the Pediatric and Adolescent Gynecology program is to provide optimal care from infancy to young adulthood for patients with medical and surgical gynecologic problems. Pediatric and Adolescent Gynecology is an emerging subspecialty within obstetrics and gynecology. There are few providers with this subspecialty within New York City, so it's very special that Mount Sinai Health System has incorporated this program into its department.
One of the things I'm really excited about is the fact that we're now focusing on adolescent gynecology. We need to train our future physicians to treat adolescent women as such.
Pediatric and adolescent gynecology has really grown as a field over the last 40 years. Gynecologic problems often present differently in children and adolescents compared to adult patients. So it's really important to have providers that have the expertise understanding the pediatric specific needs of the population. What's unique about the services we provide in New York City as an emerging specialty is that pediatric gynecologists are specially trained to really focus on developmental stages of the patient. So we are really keen to really be focused on how do we approach the patient. Our approach to care is unique. Our approach to the families is unique. So we really focus on making the patient comfortable and listening to the patient and trying to provide care as best we can in a developmentally appropriate way. This program is really focusing on the full breadth of pediatric and adolescent gynecology problems, and within that there are things that are more unique and are more challenging and complex, which really does require someone who's an expert in this field. We work really hand in hand with other specialists and other subspecialties as well. This includes adolescent medicine, pediatric surgery and urology, hematology, endocrinology, to name a few.
The reason we have a winning formula is not by accident. It takes work to find people who we think will fit in on our team, who want to come to work hard, have a smile on their face, want to learn.
That really makes us unique in how we approach patients as a team. We provide a wider range of services for young patients with gynecologic problems. For patients who are prepubertal, this most often includes vulvovaginal problems such as vaginal bleeding, vaginal itching and irritation, abdominal pain, ovarian masses. For patients who are older or adolescent population, this spans the range from preventive services such as contraceptive care, reproductive health counseling, to things that are more complex, including menstrual disorders, PCOS or pelvic pain and endometriosis, to circumstances that are even more complex, including differences of sexual differentiation, complex genital anomalies as well. We also do care for patients with special needs as well as patients who are gender diverse. My approach to new patients is really focusing on getting the family comfortable. The first visit usually spent around speaking to the patient as well as their care provider. So I have the privilege of having two patients with me at the same time. So I really work with building trust amongst my patients, building that relationship, but also for the care provider that's also very invested in the patient as well as focusing on confidentiality. So for a lot of my teenagers, I spend a little bit of alone time with them, and that also works to build relationships and build comfort level with me and gain independence as well. It's very scary to think about coming to the doctor when you're young. You may not know what's going on and you may think this is a problem that can't be helped. There also may be a lot of shame surrounding it or a fear to speak about areas of your body that traditionally is private. So what I tell young patients is don't be scared. Speak to your mom, speak to your caregiver, speak to someone who is a person that you trust, and come in. There's something that we can do. We can just talk, we take it step by step, and a lot of times patients actually realize that their problem is easily solved, or there's answers for the questions that they had, which definitely puts them at ease.
It's very important that we train the next generation of women in healthcare. We need to start educating the next generation to treat women as independent entities with their own diseases.
Women's health is so important to me because it really drives quality of life and long-standing outcomes for girls and young women. The most rewarding part about my job is really relationship building and really forming a bond with my patients, seeing them come in scared, nervous, and leaving happy, leaving independent, and leaving ready to have a very healthy life moving forward.